Greetings, myself Dr. Prerna Goyal. I am MD Medicine, Consultant Physician and Deputy Medical Superintendent at Auditorium, Ludhiana. And this is my first time participation in the MAPICON. I am really thankful to the Dr. Vitul Gupta and all the organizing team for giving me this opportunity. Today is the third day of the session of the conference, and I am here to deliver a talk on renal denervation in resistant hypertension. We have a good number of resistant hypertension patients in our society, and where the lifestyle and antihypertensive agents, they fail to provide adequate blood pressure control, and untreated blood pressure is a risk factor for cardiovascular mortality and the renal failure, for the stroke and heart attacks that we all know. So what else can be done apart from the drugs and apart from the lifestyle in such subgroup of the patients? So that was my topic of discussion, and here I highlighted the effect of renal denervation. Renal denervation means ablation of the renal nerves which are present around the renal artery, and which if by ablation we can decrease the sympathetic activity and suppress the sympathetic drive, which is a major contributory for the hypertension, so we can have a good results. And this was I talked about the endovascular approach that is used to cause to have renal denervation. There can be radiofrequency renal denervation or ultrasound based renal denervation, the alcohol or chemical denervation. And the most explored is the radiofrequency, where the radiofrequency catheters, they are introduced into the renal artery, and through the radiofrequency waves we are able to ablate the renal nerves. And then ultrasound based is using a balloon tipped catheter, where the ultrasound device is there which emits the ultrasound waves and ablates the renal nerve. And it is very great to see that both these techniques, they have helped in achieving a blood pressure reduction to the tune of like 8 to 10 millimeter of mercury. That depends whether it's office blood pressure or the ambulatory blood pressure. And the good thing is that we have simplicity registry data which have shown that the long-term effects of this renal denervation in terms of the efficacy and the safety. 3 years data is there, 9-year data is there, that shows that the renal denervation helps in achieving a good blood pressure control with almost negligible side effects. So if I say that renal denervation, what is the future in 2023 and further, I will say that it is a new tool in the whole toolbox of the antihypertensive treatment. And if something is not working, like lifestyle and antihypertensive agents are not working, it is another tool of renal denervation can be tried in a patient who is at very high cardiovascular risk, who is having uncontrolled blood pressure. So this is a new modality which is still under evolution. Maybe in India we have few cases that has been done till now, and in the next few years, maybe in the coming decade, we can see RDN as a new armamentarium in the management of hypertension. Thank you so much.